Welcome to the SWIKE podcast, the only podcast that shares the stuff you didn't know you needed to know about jobs, careers, and life. The SWIKE podcast, the stuff I wish I knew earlier.
Hi, everyone, and welcome to the SWIKE Stuff I Wish I Knew Earlier podcast. We're here again with our guest host, Eram, and we thought we'd have a conversation on staying safe in COVID. So this conversation is probably long overdue, and given her background as an ER nurse, so we thought you'd have a great perspective in terms of discussing. So right now, we're recording in July 2021. The province, the country, the world is starting to open up a little bit. The vaccination rates are a little bit on the rise, and depending on which part of the world is, folks are getting a little bit more optimistic, and maybe it's also the sun shining and warmer weather in at least the northern hemisphere. But it's still a time where folks need to stay vigilant, right? Because we're not out of the woods yet. But there's so many pieces of advice, and information, misinformation. So we thought we'd have a conversation on kind of what's the most important parts of it. So we all know that we need to wash our hands more and wear masks and stuff. But do we? I actually was just having a conversation with someone this morning, and they had mentioned well, masks are not effective. So what are some of the things that you would want to confirm or deny and say, okay, what's important about staying safe in COVID?
Hi, thank you so much for having me again. Definitely washing your hands reduces transmission of any disease. That's just kind of like the standard of any disease. Wearing a mask is very important because of the mode of transmission of this disease. There have been a lot of debates as to see whether it's droplet versus an airborne disease. Mm-hmm. And then, there's the issues on people are still getting it. They go out and then, they still contract the disease, and somehow it's like, how did you get it? Or how did I get it? Was the question, right? So, you have to also think about different things. It could also involve the type of mask that you're wearing. Mm-hmm. A cloth mask versus a surgical mask versus a respirator makes a very big difference. Sure. A cloth mask is not as effective, but it is better than wearing no mask at all. Sure. And a surgical mask is obviously much better than wearing a cloth mask. And of course, the best one is an N95 or NIOSH respirator. Right. So if you can obviously get your hands on those and purchase that, you can wear one of those. I think the other thing is possibly exposure time. Mm. So if you're around someone that is not wearing a mask, then highly likely there is going to be some exposure there. Right. But if you're both wearing masks, it's going to reduce the transmission. In terms of whether you get it or not, sometimes is a bit difficult to say. So again, it's like exposure time. So there have been some studies that have said that, it goes up to 15 minutes. If you go beyond 15 minutes and you're not properly protected, then chances are you probably will contract COVID.
Yeah, I guess that's an interesting perspective and a lot of useful information in the sense that, well, a lot of it is at the end of the day risk mitigation, right? So you can't protect yourself from anything and everything, right? At some point, you have to live your lives. You have to go out there, get some groceries and things like that. So to your point about minimizing exposure, I think that's kind of the key. So for those of you who want to wear a mask or don't want to wear a mask, it's the main thing is trying to stay out of the hospital, stay out of the ER, and then, staying away from Eram in that context, because she doesn't want to see you, I guess, in there. So what are some of the common things that I guess you've seen during this pandemic, and what are some of the things that people could potentially do to stay out of the ER? So definitely it's the washing of hands and wearing masks. Are there other things that folks could do to stay out of the ER?
I would definitely say go for essentials only. Mm-hmm. Try to limit your visits. Follow public health guidelines. So, we're now in stage 2 currently in Ontario. Mm-hmm. So follow those guidelines accordingly in terms of the number of people that you can have indoors versus outdoors. Try not to go for things that are non-essential. Get vaccinated, please. I do understand that there is a lot of controversy on vaccines. But like any vaccine or any medication that you take for anything, there is going to be a bit of a side effect from it. Sure. I myself am fully vaccinated, and I can tell you that it has helped us so much because we're frontline and we've dealt with patients that are the sickest of the sickest with COVID-19, things that we've seen that you can't imagine. People don't fabricate shortness of breath and come in. People don't want to be placed on life support on a ventilator. That's not news that you want to give your family members or that you want to give to others. So please get vaccinated. Very, very important. And, again, follow public health guidelines. Really, really important, and only go for essentials.
And what about the folks that kind of say, hey, now I'm double vaxxed and I'm safe, I'm invincible, and start kind of doing kind of anything and everything? What would you say to folks in with that perspective?
Stop right there.
Okay.
Slow down, stop right there. Yes, you're vaccinated, but that doesn't mean that COVID isn't entirely eradicated just yet.
Sure.
This is why we need to go in slow stages while reopening, and not to jump the gun. Just because you're vaccinated doesn't mean you can go in a crowd of 500 people and think you can do whatever you want, or just jump on a plane and go to Hawaii or go off to the Caribbean. And while that's all very, promising and very tempting, we still have to be mindful because this is a very new disease. It's a very novel disease, and we're still trying to discover new things about every day. And on top of that, there's a lot of variants. Variants are the issue. Different types of variants can actually increase transmission rates, but also increase hospitalization stays. Probably most importantly, most notably, ICU admissions and being on life support. So very important to take note of that.
Yeah, and what I've heard from that perspective is that, yes, you might be vaccinated and kind of impervious and immune to the current COVID strain, but then if other people who aren't, and then that's when things can start mutating and turning into these variants that you might not be immune to. So the more that you can kind of stay local and keep the spread intact, then the less likely you'll have to worry about these variants to begin with, and then we can kind of get back to whatever the new normal is going to be, but at least to something that's a little bit more open and available and free, so folks can travel, visit loved ones, and all that sort of stuff. So how would you say that the COVID experience has changed you? So some of the work that you've done would probably be affected as well, but how has it changed kind of the work that you do and yourself specifically?
Well, furthermore, what I'd like to say is that I think a lot of people that are at risk are those with comorbidities or those who are immunocompromised. So they do need to take more precautions when going out or going for essentials. Try to see if you can have limited contact or no contact, i.e. getting groceries delivered and so forth. But right. In terms of how it's changed, and in tying that in with everything else, I think that COVID-19 should now have opened eyes of everyone's eyes. I think it should now have opened everyone's eyes, including that of the government, because, this is a pandemic, and, the way things are handled, some things should have been handled a little better, in my opinion. Right. And, usually there's a disaster preparedness plan. And I think personally, when SARS and Ebola happened, I think that should have been our wake-up call to say, okay, if this happens again, this is what we need to do. And it seems as if that was not instated. And I think that's why a lot of things went through the cracks. There were a lot of loopholes, and I just think that looking back on it, I think we need to really revise and state in a disaster preparedness plan across the country, in hospitals, in facilities, really not focusing on old facts or old science just to determine that it was a droplet disease when in fact it was airborne. I mean, COVID is SARS too. It's the sister disease of COVID. It's the sister disease of SARS, which was airborne. So, and now we have all these variants. So I think that, it should really open a lot of eyes. It should really have a lot of revisions, ongoing research in terms of vaccines, promoting vaccines and more research and developing more vaccines. I think that it has definitely changed the way that we live our life. The way that we used to live so carefree and just quickly say, yeah, I'm just going to go out and meet this person for dinner and stuff. Well, now it's a little different. It's like, okay, well, should I meet this person for dinner?
Right.
It's even like human affection is now in question. It's like, well, shaking hands, probably not a good idea. Giving a hug, probably not a good idea because of the risk of transmission, right? You don't know where people have been. Even if the person assumingly thinks that they've been around people who are, COVID free, well, sometimes that's what happens and they get COVID. And this is why they're like, oh, well, I don't even know how I got it, right? And sometimes they're asymptomatic, but they test positive for COVID-19. So, in terms of healthcare professionals, how does this change our perspective on things? We continue to enforce a lot of the things that I just discussed for our patients and their families. Mental health wise, a lot of healthcare professionals are very burned out. They have chosen to leave the profession. There's high turnover. It's not a big surprise. They decide to either leave the profession or go branch off into a different aspect of the profession so they don't have to see quote unquote so much trauma that they've seen with all the COVID patients they'd have to deal with. When you have COVID, you become very sick.
Right.
And some people become so sick that they end up on life support. It's not really a joke because, to all the people out there that don't really believe it, people don't fabricate shortness of breath.
Right.
It's the hardest thing to see when someone cannot even breathe, when they're struggling to breathe. That's a painful sight. So, it's changed a lot of the aspect. Some people are staying strong as best as possible and trying to take advantage of a lot of the resources available for counseling for healthcare professionals, which is called an EAP, the Employment Assistance Program. Other people resort to other things to help them de-stress. Like, it could be exercise, it could be listening to music, it could be writing, it could be journaling, spirituality, prayer, meditation. And another thing is that, the crunch of the lack of healthcare professionals. So, for example, a lot of the nurses that are choosing to leave the profession is very evident. And that's why you can see that there's a mass turnover. And a lot of places are trying to offer cash incentives to pull nurses in so that they'll come in. So they'll have a large sign-on bonus and then offer a high pay rate per hour. And I really think that in terms of that perspective, like, yes, it's a one-time, like it is a good idea. I mean, don't get me wrong, it will attract a lot of people, but it also says a lot in terms of what's happening with the profession. Like people used to want to go and work because they wanted to work, or people had that passion to go and work. But now they have to use a cash incentive to drag people in to say, come work here. Here's your sign-on bonus of $10,000 if you sign a contract for 1 to 2 years. Or you can get some places are going as high as maybe even really, really high. I'd even say maybe $50,000 to say, here, stay with us for about, 4 years. Here's your sign-on bonus, plus you get this, plus you get that, and you get a high pay rate as well. And while that all sounds fascinating, it's a very Band-Aid fix for a long-term problem.
For sure.
Because it's like, what happens after the pandemic, right? So, and if the pandemic slows down. So yeah, that's just from what I tell you in terms of experience, what I've seen, and what's been going on.
Yeah, so there's a lot to unpack in there, and it sounds like that for those out there that are eager to go into the healthcare profession, there's probably going to be a lot of opportunity, because it sounds like that a lot of people are moving out and because they're burned out and stuff. So might be some opportunities there, especially given that they're giving this kind of incentives. I almost think that's kind of like danger pay, right? Basically the equivalent of that. And other things that you mentioned where people talk about like being vaccinated and well, a lot of people have had side effects, and they've been out for like a couple of days here and there. But some of the discussions that I've been having is like, well, that's basically COVID light, right? So you're basically having these side effects, but imagine having the real onset of full-on COVID would have been much worse. So just be prepared, or just think that from that perspective. So if you think that's bad, then the real thing would have been even worse. And I'm glad that folks are taking things like the employment assistance programs, and the government and different companies are doing a whole bunch of things in order to help folks, because it is a challenging time. And it'll be interesting to see how we start moving forward as more of the kind of the back to work orders are created, and more people are going to go into the office. I'm guessing there's going to be more of that kind of hybrid where it's going to be a couple of days a week, minus the ones where like you really have to be in the office. But a lot of companies are saying, you know what, we can work remotely, so why don't we do that more often? But yeah, so what would be your hopes in terms of like how do we move forward, right? So the province is opening up. We'll be at stage 3 soon, and hopefully fully open. But at the same time, this is something where we're probably going to have to live with it, in the sense that we shouldn't be surprised if there's like a COVID 2029, right, in a couple of years. Because, well, SARS was like 2002, Ebola was I forget what number, 2000 and something, but it sounds like it's probably going to be every, I don't know, decade or so there's going to be something. So hopefully, as you said, it opened our eyes. But what do we do for not maybe if, but when the next outbreak happens? How do we stay kind of vigilant and continue on to prepare ourselves for that next time?
Take this experience and apply it for the future. And I urge disaster preparedness plans, review, revise, and state. Very important. I do understand that we're probably going to end up in the final stage of opening very soon, but that doesn't mean that everything is already back to normal.
Right.
Just like any communicable disease, it's going to cycle through. But the problem is that there's so many different variants with so many different forms of transmission, and it's still, like I said, an evolving disease. It's very new and it's very evolving. So we still have a lot of research to do. I would just strongly suggest everyone to just stay safe, continue practice and measures, get vaccinated, very important. And, try not to go in large crowds at this time. It's too soon. Mm-hmm. It's way too soon to get involved in things like that. We're not at that stage yet where we have 0 cases. We still have cases trending.
Sure.
And I mean, yes, we had a 3rd wave, but then the question is there going to be a 4th wave?
Right.
They're discovering variants all the time. So if that variant becomes popular, that's going to be our 4th wave. We already had a 3rd wave where we had the UK variant, and now there's the spread of the Delta variant that was found recently, I believe, from India. And of course, it's spreading. And so, when they find these variants and the level of danger that these variants and the symptoms that they cause, which is shortness of breath, and people end up on oxygen and on ventilators and things like that. These are things we have to consider. I mean, like, is it really necessary? Like I said earlier, is it necessary for you to go to a huge rave or a party of 500 people immediately? I personally don't think so. I mean, yes, you can enjoy your life, but I think that you have to be very cautious on how you do so.
Yeah,
a lot of people. Yeah.
Oh, go ahead.
Oh no, I said, a lot of people are just making the assumption like, okay, it's over, it's done. It's not. It's not quite over yet. I still think we really need to be, very, very cautious with the way that we live. And it's very unfortunate that we can't live as carefree as we used to. But it's now this is now our new normal.
Right. And what I took from that is, I mean, a little bit of caution, but a lot of hope as well, in the sense that, well, caution in the sense that, well, we're not out of the woods yet, so to speak, right? So we probably need a little bit more time before we kind of have those mass gatherings and whatnot. But there is hope in the sense that, well, we probably won't be that far away from it. It might be a few months, hopefully by the end of the year, maybe even sooner, or who knows. But it's really up to us, in the sense that if none of us do anything too silly, then the time frame will be shorter, because then we won't have any more of those variants. But at the end of the day, it will be kind of that wake up call for a lot of us, and for your point about the disaster preparedness, where at the end of the day, it'll likely happen again in most of our lifetimes, right? So in kind of like the 10-year mark, there'll be something. So when the COVID 2029 comes, or whatever it's going to be, we'll be a little bit more prepared, probably a little quicker to react, and kind of know how to handle it a little better, so that we can not have to spend, what is it, almost 2 years or a year and a half in this sort of situation. But yeah, I think we're moving forward in the right direction, and let's still stay vigilant in the next little while. So, are there any kind of last parting words as we close off this episode, in terms of how to keep people safe, or some things to think about as they're in this kind of COVID situation?
Take it heavily into consideration. COVID is no joke. And as I've stated earlier, SARS and Ebola should have been our wake-up call. This is now our reality check. Because, I mean, pandemics have been happening for quite some time. And even though this might become eventually eradicated, something else may pop up in the future. So the only thing I just have to say is stay safe.
On that note, thanks so much, Eram, for joining us, and hopefully we'll have you back for another episode.
Thank you so much.
Thanks for joining us on the SIWIKE Stuff I Wish I Knew Earlier, the podcast. If you like the podcast, please subscribe on iTunes, Stitcher, or wherever you found this podcast. And if you can give us a review, that would be very appreciated. Feel free to contact me on LinkedIn at LukiDanu, LukiDanu, and the same on most social media platforms. And I look forward to hearing from you. Thanks. Bye.